As a doctor, I often see how fragile, and at the same time how essential, our nervous system is. One of the most dangerous injuries it can sustain is trauma to the spinal cord. For some, it's just a medical term. For others, it's an event that changed their lives forever. So let's break down what happens during a spinal cord injury, what types exist, and why it's so dangerous. The spinal cord is like the main cable connecting our brain to the rest of the body. It runs through the spine, well protected by bone. But even this protection doesn't always save it. The spinal cord is responsible for transmitting nerve signals. It's how we move, feel touch, pain, and temperature. Spinal cord injuries typically occur as a result of trauma, car accidents, falls from heights, sports incidents, or even domestic accidents. Sometimes the cause can be tumors, infections, or vascular damage. These injuries are classified as incomplete or complete. Incomplete injury means that some nerve signals still get through. The patient may retain some movement or sensation below the level of injury. Complete injury means all signal transmission is blocked. This leads to total paralysis and loss of sensation below the damaged area. The level of the injury also matters. If the cervical spine is affected, the person may lose control not just of their legs but also their arms. This is called tetraplegia. Injuries to the thoracic or lumbar regions usually result in paraplegia, affecting only the legs. Another crucial factor is spinal cord compression. Bone fragments or swelling can press on the cord. If this pressure isn't relieved quickly, the damage can become irreversible. Unfortunately, the spinal cord doesn't regenerate the way muscles or skin do. Once its tissue is destroyed, the damage is permanent. That's why prevention and proper first aid are absolutely critical. But more on that, in the next episode. As an experienced doctor, I can confidently say, when it comes to spinal cord trauma, the first few minutes are everything. What is, or isn't, done at the scene often determines whether the person will walk again or remain in a wheelchair for life. Let's talk about the most critical types of spinal injuries and how to avoid making things worse. Most dangerous types of injuries. Cervical spine fractures and dislocations. These are among the most dangerous scenarios. Often seen in car crashes or diving into shallow water. If the upper cervical spine, C1, C2, is damaged, a person may lose not only movement but also the ability to breathe without assistance. Acute spinal cord compression. Caused by bone fragments, hematomas, or tumors. Compression rapidly leads to ischemia, lack of blood flow, in the spinal cord. Even a few hours can make the damage permanent. Spinal shock syndrome. A temporary but extremely serious state. Right after injury, there's complete loss of all function below the level of damage. The patient appears fully paralyzed. Sometimes, functions begin to return after a few weeks, but not always. Secondary damage from improper transport. Sometimes, the initial injury isn't catastrophic, but improper handling makes it worse. If the person is lifted, moved, or seated incorrectly, bone fragments can further compress the cord. In such cases, doing nothing is better than doing the wrong thing. Warning signs of a critical spinal injury. Loss of movement or sensation below a certain point. Absence of reflexes. Incontinence. Difficulty or inability to breathe, especially with cervical trauma. Severe neck or back pain after trauma, worsened by movement. What to do if you suspect a spinal injury? Don't move the person. If there's even a slight suspicion of spinal injury, do not sit them up, shake them, or try to help them walk. This could cause irreversible damage. Stabilize the head and neck. The priority is to prevent movement. Use a cervical collar if available. If not, use rolled towels or hands to manually stabilize the head and neck. Call emergency services. Tell them clearly, possible spinal cord or vertebral injury. The response team should arrive with proper immobilization tools like a backboard and neck brace. No food or water. If surgery is needed, eating or drinking can complicate anesthesia. After many years working in trauma care, I've seen countless cases. Someone dove into a pool, someone else got into a crash, someone slipped on ice. All of them had one thing in common: their spinal cord couldn't take the hit. But the most frustrating part? Many of these injuries were entirely preventable. So in this final episode, let me share practical, life-saving rules, no scare tactics, just facts. 1. At home, watch the small stuff. Most falls don't happen while hiking, they happen at home or right outside. Make sure hallways and staircases are well lit. Use non-slip mats in the bathroom. In winter, wear shoes with grippy rubber soles. Avoid standing on chairs or ladders without support, even a small fall can fracture a vertebra. 2. In sports, don't be a hero. Pools, trampolines, skiing, biking, all great, until someone forgets about safety. Never dive into unknown water. The most common cause of cervical spinal trauma is diving headfirst into the shallow end. Helmets aren't fashion, they're protection. Whether you're cycling, skating, snowboarding, or motorbiking, wear your gear. Don't overdo it at the gym. Without proper form and preparation, you could injure your back, and sometimes your spine, permanently. 3. On the road, think ahead. Simple rules save lives. Always wear a seatbelt. Driver or passenger, short or long trip, no exceptions. Use proper child seats. And make sure they're installed correctly. Don't ride with your feet on the dashboard. In a crash, this can lead to devastating spinal injury. Motorcyclists, no helmet equals massive risk. It's that simple. 4. At work, respect safety rules. On construction sites, in warehouses, in factories. Ensure fall protection when working at heights. Wear safety gear and helmets. Don't treat safety briefings as just red tape, they exist to protect lives. 5. For everyone, be informed and cautious. Learn basic first aid. Knowing how to stabilize a neck could make the difference between recovery and paralysis. Teach children and teens the risks, not with fear, but with facts. No roof jumping or door swinging. And most of all, don't think, it won't happen to me. That's what everyone thinks, until it does. In conclusion, the spinal cord has no backup. And while modern medicine can do wonders, it's better to avoid the injury altogether than spend years trying to recover from it. Take care of yourselves, and your spines.